Gentlelady from Tennessee, Ms. Blackburn.
Thank you, Madam Chairman. I thank you for the opportunity to raise my concerns on this bill. My colleagues have all spoken eloquently on the ramifications of the outrageous cost and the impact of government micromanagement of our healthcare delivery system. I could only repeat what they have said. My concern is over the repetition of history that I see unfolding before me. What might seem like bright new policies in Washington, D.C. are really reminiscent of the painful past in Tennessee. There is a test case for public option government-run health care, and it was an apocalyptic failure. Tennesseans have been down this road, and we do not want our nation to go down the same road. For more than a decade ago, when Tennessee introduced managed care to replace Medicaid, we were promised cost savings, deficit neutrality, more and better health care for all. We wound up with a program, TennCare, that consumed every dollar of new revenue and almost bankrupted the state. We have had a decade of court orders, consent decrees, budget battles, and funding fights. Education and economic development priorities have been set aside just to fund TennCare. And during the process, what happened? Well, guess what? Quality of care declined. The cost skyrocketed. Rationing of health care ensued. Access was closed, and patients were actually removed from the program. We cannot afford to spread the missteps and the problems of TennCare on this nation. Do I think that some components of the health care and medical care delivery system should be reformed? Yes. But it should be done in a way that can reduce cost, yield more options, allow greater choice, use market forces, and yield an affordable, accessible, patient-centered system. Mr. Chairman, I strongly urge my colleagues, and indeed even the reporters that are covering this hearing, to think about something. Take a look at the lessons that we learned from TennCare. Ask yourself and ask the bill sponsors how they have learned from a program that even our Democrat governor called, and I'm quoting, a disaster. Ask them before we commit 17% of the nation's GDP to the same plight. Debt incurred is opportunity denied. Tennesseans are still cleaning up after the TennCare debacle, and any Tennessean can tell you how many opportunities we have been denied because of it. Thank you, and I yield back the balance of my time.
Gentlelady yields back.